May is Women's Health Month, and it's a chance to have important conversations about things like preventative screening, stress, and mental health. But also we want to talk about alcohol because experts are sounding the alarm on alcohol-related deaths among women climbing. So we asked Dr. Lisa Saul to join us today to help us better understand this troubling trend. She is the Chief Medical Officer of Women's Health at United Healthcare, and we're so glad that you're here. We get to talk through this together because this is something that is so normalized in our society today, having a couple drinks.
It is definitely woven into the fabric of our society, as you say, and we're on the eve of wedding season and graduation season, and alcohol is a big part of the things that we celebrate in our lives.
Yeah. How much is too much?
Well, 8 drinks a week for women is considered too much, and binge drinking is what we're talking about here, is also consuming more than two to four alcoholic beverages in a 2 to 3 hour window. So over time, over the week, there's that, but also in one sitting we need to be thinking about.
What do we know now about alcohol and its impact on our health?
Well, a lot of people are surprised to know now that alcohol is related to serious health concerns like cancers, like colorectal cancer and breast cancer, but also liver disease, heart disease, hypertension, and even stroke. So the impacts are very significant.
And there are unique risks for women as well that you wanted to lay out.
Well, it's important that we think about the spectrum of women's health, and even starting for young girls as young as 18 to 25, we're seeing that about 1 in 3 young girls are binge drinking. And so if we think about that compounding over a lifetime, by the time that women get to be middle age or elderly, that can result in things like alcohol-induced dementia, which has significant consequences.
Yeah, let's walk through the ages, because you got your teens and 20s, but you also want to talk about alcohol impacts for women during pregnancy, or moms or into our elder years.
Well, what we don't know is that there's a safe amount of alcohol in pregnancy. And so the best advice and guidance is that there is no safe amount of alcohol in pregnancy. Alcohol can, in any amount, cause fetal alcohol spectrum disorder, miscarriage, and stillbirth. And so that's really something that we need to make sure that all pregnant women and women that are planning to get pregnant know.
This is an interesting trend. You know, moms having wine, normalize, mom just needs a glass of wine after a long day, and sort of, yeah, again, part of that normalization, but you say that that can go too far.
Well, we saw it pick up quite a bit in the pandemic and beyond the pandemic. We're seeing more alcohol-related deaths in women post-pandemic. And if we think about the things that we see in our culture, like mommy juice, when it's a wine glass or it's wine o'clock. These are the things that are just part of our lexicon now and part of our culture that I think women really need to pay attention to as it relates to what the long-term health impacts can be.
How do you think people can improve their relationship with alcohol?
Well, I think what we're doing now, the awareness is really important. Planning ahead and thinking about what am I going to drink? Same way that people think about what they might be eating when they go to an event, a wedding, a party.
Sure.
How many drinks am I going to have? Am I going to drink at all? And exploring some really fun and festive non-alcoholic options. There's more and more out there in the market now that can make it as fun as a glass of wine.
Yeah, you just got to be thoughtful about it. Where can people go for help or more information about this?
I think it's really important, if you're concerned at all about your alcohol consumption, talk to your doctor, talk to a trusted friend. You can go online. The CDC has references and resources for people who have more questions about alcohol use.
Yeah, and like you said, just rethinking it a little bit.
Absolutely.
Yeah. All right. Thank you so much.